Okay, thank you. Prior to talk about the survey, I'd like to mention that our primary goal is to provide person-centered care to our participants. I consider all kinds of audit quality control tools. So when we talk about the survey, it's one of the tools of the quality control that just come here and help you to fulfill the person-centered care as a state requirement. And the maximum period for the CBAS center certification is 24 months, which means that all the CBAS center would have at least one survey every 2 years. Okay, and here for the documentation, there are two types of documentation that we need to pay attention to. The first one is administrative record, and the second one is health record. What about the administrative record? That's considering the just mentioned Dr. Cole. It's center's policy and the procedure, the training logs, including staff timesheet, MDT, meeting note, and staffing's arrangements. And especially during the TAS period, the administrative record, that's including also the TAS in-center service checklist. And you can find out that's a CDA 7015. That's pretty much the important that you can download from the department agent's website. Okay, that's about the administrative record, but I'll focus on also the health record. That's pretty much health record that you can find in the participant's medical chart. That's including all the information, the individual plan of care, IPC, quality, progress note, flow sheet, NDT reassessment, and for the test period, I also need to include COVID-19 screenings. And I remember CATS, they do have a format. It's named like COVID-19 participant wellness check and the risk assessment. It's just a format for your information. You can create your own center's screening tools, but it's good to use that form as well. So here comes the interesting part for the surveyor. And based on the statistics from department agents, there's the 5 most frequent deficiency for the CBAS centers. And I would like to mention, just for your information, then we go to a documentation, then how we can fulfill or to do the better documentation. Okay, the first one, the top one is the IPC not developed to meet participants' need. Everything's come from there. Then we're going to go deeper and see how that works and for the documentation. Then the second deficiencies could be failure to maintain complete participant record. Okay, so you have a service provided, but your participant record is not completed. Then we have a failure to meet license requirement. We have a service not provided. We find out there's a lot of information that you do have participant needs, especially for the TAS. During the test period, you have the information you needed to provide certain kind of service. However, the service is not provided because of certain reason. Okay, then we'll see how we can work it out, or because there's no real life coordination. We just overlook it. And then we fail to contact the primary healthcare providers. I don't think just our PCP, the primary care healthcare providers, but I would say the whole team, your NDT team, the people when the doctors call, she's showing the operations diagram, you see a lot. There's like 20, 23 boxes there. It's everything here in our team to provide the service. It could be the PCP, it could be your staff, LCSW. Then we'll see how we can work it out on that. And those that I just mentioned is the top 5 from the deficiency. Okay, so one of the case you might find out in your chart, to mention just one, for example, Mr. John, he has the real diagnosis of diabetes from the doctor's HMPs. Okay, so you figure out this participant has certain diagnosis. You immediately, it's going to trigger, you need to provide certain kind of service. Okay, so what's included? Monitor the blood sugar level, provide the diabetes diet, you need assessment from the dietitians, etc. Okay, so it's just one trigger for one diagnosis, and you can trigger many things that you might need to cover. That's, I would say, that's considering participants' need, and go to transfer all this documentation, your progress note, and also your IPC. Okay, so what about the best practice for the documentations? Okay, to identify participants' needs, we need to first create a person-centered care IPC. I think we all agree about that. Okay, the service provided and ensure the documentation. You document all the service in your progress note. Before the task period, we have the flow sheet. Remember, if there's a different kind, you need to check the day when they attend to your CBAS center. You need to check, and then you have to categorize what kind of service you provide. That's a flow sheet. Okay, but right now the test is go more like a narrative. It's go more like a progress note, but it's the same. We need to have the documentation to follow all kind of the needs. So after that, you have to follow up with the outcome. The service you provide, you need to follow outcome and the result, and you need to follow up and follow through. That means you need to complete all the cycle from the beginning when you find out the need, and you need to give me the answer or how you do the service. That's, I mean, a follow through. Okay. So it's everything's ongoing process and the ongoing assessment. Okay. For the task documentation, we would like to recommend you to read the ACL, which is all center data, especially in 20-09. It's a documentation. It's talk about the guidelines of how you do the quarterly progress note, how you do the IPC. It's all right there. So you go there and see and read all these all centers data. It comes with a lot of information. We also have for continued participant, it's a little bit different from the initial participants. Okay. So well, right here we have can we go back to the slide of the best practice documentation? Okay, the best practice documentation that we have a person-centered IPC. We talk about besides the IPC, especially there's a box we put more attention during the test period. It's box 15 and the box 16. Okay, the box 15 is a significant changes for your participant. That's especially you need to reflect. I would like to match the picture of the participant in the progress note during these 6 months, or when you do the quarterly, in these 3 months, I want to see something in your progress note. That's how I check that one. And about the box 16 is a little bit about different critical information that does not mention in other parts of your IPC. Okay. We mentioned about the CDA is 701515. It's for in-center service. During the task center, remember, not all the CBAS center they provide in-center service, but if we want to provide in-center service instead of telehealth, you need to have the 7015 there, and they talk about how you assess the participant needs. When you want to provide this kind of in-center service, you need to contact the family member or caregiver or the participant. You need to explain to them know this when we open the door for you, it could have some kind maybe exposure to the virus of COVID-19 and other service was provided. So it's based on the needs of all the participants, okay, and based on the need of all the centers, what kind of service they do want to provide. So there's a regulation right there, and you need to have those PMP and the protocol and the staff training, okay, before you have the in-center services. Okay. We also talk about many times about participant needs. We are going to go deeper for that one. The service provide, you need to coordinate everything, and when you provide a service, you need to go to documentation, and then you go back to your documentation. You have to see the progress note, and then you go to quarterly and see all these documentation make sense, make a whole picture to complete the service you provide. It's not just like a chap. We figure out when we do the kind of the chat review, we sometimes see the one of the team member start one of service, or they just mention the needs or outside the issue, and there's no follow-up. Okay, so you just open, you trigger the participant need, and how come you don't finish everything, all the service you provided, just like you have to. Okay, and also we need to have the follow-up. Okay, so just this is all about best practice documentation, not for the survey, but all kind of service you need to provide. Then we will go to for the next slide, please. The TAS documentation challenge. Okay, so I believe the challenge for us, especially during the TAS period, since we do have different kind of service we provide. Some of the center that do telehealth 100%. Some of the center they have a staff in the center and provide the service. Some of the staff center they do both the hybrid model. They have the telehealth, they have the center open, they receive the participant. So it doesn't matter how, but I believe I find out there's one thing that we need to pay more attention, which is communication issue. There's a many issue or documentations that you don't complete because the communication is incomplete, or it's not like fail to be complete on time basis. So I'm talking about the coordination of the real-time care coordination and the documentation. What's the real time? Okay, I'll kind of give you an example for you. You have a staff delivery, provide the delivery package to your participants. Then you put your packets there and you say hi to your participant or the caregiver. Then the caregiver tell you, okay, Mr. John, he fell or he was hospitalized. Okay, so what will you do? Do you wait until next day? And when you come center to pick up the package and to tell the nurse or the program director that says, this has happened to Mr. John. No, what I'm doing is a real-time coordination, which means that you can make a phone call, you can test, you can do something to make sure that someone who is in charge, in this case, maybe nurse, maybe social worker, they start coordinate the service and start to input the documentation in the progress note. So we can change. If, for example, if the participant is out, do not need more package delivery, so immediately they do know, and for the next day, the coming day, they do not need to prepare the meal, okay? Or they need to follow because of Mr. John is fell, he is in hospital, and what kind of service you have to provide. You just follow your common practice, okay? So that's what I mean, the communication issue and the real time. Then there's a many documentation. We use a different communication software, different, sorry about it's EHR, is electronicals, health record, and the report. And that means like there's a documentation we need to fulfill for the electronics health record. And I know there's many like commercials, softwares around the CBAS industry. They have a different use, and everyone chooses what they think that's the best. But I think the communication, we have a plenty to choose right now, and you can choose the best for you. For someone they do not have the lot budget, they can do an easy way. Someone have a lot more budgets, and they can choose something different. Okay, so it's up to different CBAS centers. Okay, I would like to share one experience that how we do the real times care. That's using everything is already online. We use the Google Drive, and you know Google is very common, it's very easy to use. And when you use a Google Drive, you use a Gmail. And this is one way of communicate. It create a lot of Google's Drive. You can put your documentations right there, your IPC, your quarterly, your progress note, including all kind of tracking. And when you do a telehealth at home, you can have whoever just go there, have the password, okay, maybe just open it, and or log in, just like logging in your personal email. It's very easy. Do not require a lot of training because we all know how to email. And we just go there and click in, and you see a lot of information that you could do. And it's open. It's not like closed loop. I mean, it's just very close. Only people who is in the center can do the documentation. But at home, you can certainly do your communication through all those kind of the communication software. Okay, so that's the tool I mean. Your phone, that's easy. That everyone know how to use it. Your WeChat and everything. But forget about the Facebooks. There's something that hip hop you need to pay more attention. Not all the tool, not all the software is allowed. You need to make the most sure. You need to check, and you need to talk to your administrator or your program director. Is this software is safe? Because we all talk about hip hop. We don't want to have the EHR to go everywhere and everyone can just access that one. It's not good. Okay, it's a violation. So make sure that, and then you can use the tool, and easy to do. That what I just want to say is like try to use a simple, easy way to communicate within your team and your caregivers, and even with your participant. That means they already know how to use it. What about the phone? What about the test? I mean, the test through the phone. Okay, what about the iPad? What about the tablet that you are using to do every day? That's the way easier for people to use. I still believe that a lot of people, they do not have a tab. They don't know how to use that. But that's what I'm talking about, the training. Not all the people is savvy for the internet. Someone has phobia, and they need to see how to work it out. You see how your team work out the best. You see how's the best way to practice, even including the caregiver, including your participant can have a direct contact to all your members. Okay, so we do practice that. Once they can put the feedbacks immediately to the program director, to our nurse. I don't like your meal. I prefer something else. I really appreciate your help. I have something. So there's create the real-time care coordination. Okay, and it's not just about our CBAS center staff. We're talking about caregiver who is at home and 24 hours with your participant. We're talking about the participant per se. Everyone should be in contact, but make sure HIPAA's issue. Okay, that's what I mean, everything. Okay, and if you choose to use one, and you need to train your staff to make sure they know how to use it, to make sure they don't violate the HIPAA regulation. Okay, so can we move to the next one? Thank you. Okay, so I think we do have the case study. After the case study, I would like to share my experience how we do the documentations audit. So Dr. Cole, do you have any the case study? So we can see how we can correct it, or how we can work it out on that.
Okay, I'm sorry, I didn't unmute myself. I believe that what Charles just shared with you guys is very important, documentation. And also that I want to remind you about one house rule, and I don't remember that Anthony tell you or what. And I believe that this platform is, we created for shared experience, shared information, making friends. And I really want to see your faces. And if you can just put a video on, and even have half face and half on the sitting, I don't mind. But and I hope that these sessions, and we're going to do 8 altogether, so we will become a family. And I'm very glad that I see one of my students here, and I see one of my program directors here. I'm very proud of you, especially remember that the first session that I I shared, and then in my classroom, and she told me that I want to be the one like her, like you. Oh my God, that's really got me going. And I'm very proud. And she, you know, started with the volunteer, and then the intern, and then, you know, finished school, got degrees, and then social worker, and now she's the program director. See how proud I am. And she's taking care of more than 200 participants now, including my mom and dad. I'm very, very proud. And also that I remember the first session I shared the stories of one of my very proud program director. She's here too. So, you know, I just really hope that we can be a big family and we help each other and we share. And that's why, you know, my quality of life group to support this program, and it's all free of charge. And I really hope that we can learn. And okay, now come back to the documentation. And one thing probably I want to re-mention about the survey, and in terms of documentation, and the state want 9 items. If you have a pen and a piece of paper, I hope you can write it down. And just in case the state will conduct the survey very soon to your center, maybe next week. And they want HMP information for the participants. And they want the current participant contact information. You can provide them the face sheet. And what they really want is their phone number, their email, their families, and they can, so that they can call them. And also they want the signed, it says signed participation agreement. Okay, and here, and also I want to mention about me and Charles and I, we share our best practice. And of course, you have better practice, and we want you to share with us as well. And we're not the surveyor, and we are the provider, and we are the operator management team, and we like to learn each other. And then the fourth thing is the 2 most current IPCs. So it's covered at least 1 year. And number 5 is documentation of the COVID-19 wellness check and risk assessment check for prior 3 months. So you need to prepare for 3 months the wellness check and risk assessment Charles just mentioned about. And also that they want the daily service and progress notes of each disciplines, and providing the services for the prior 3 months. So not only the you know, the wellness check, they want to look at the notes. And also that the home assessment that you conducted. And the last one is for the discipline not currently providing services, submit reassessment that support the prior IPC, such as activities, PT, OT, mental health, speech therapy, dietitian. So those are the documentation. Okay, now we move on to the case study. Charles, and this is what's going on with us. And I have a case, and the surveyor found out that when they talked to the nurse, and the nurse in the nursing wellness check and risk assessment, she marked caregiver stress. But back to the same person's social worker didn't have the follow-up notes on caregiver stress. Let me let somebody in again. Okay. And how do you handle this?
Okay, so again, I say the documentation and the coordinations. There's 2 main focus you have to follow. I say in this case, you remember that we do a COVID-19 assessment screen every weeks. So which means we have every weeks updated regarding to our participants' need and his conditions at this moment, we mentioned about the caregiver stress. And it could be the caregiver, it could be the family member, but it's the person who's taking care of the participant. And we actually say in this case, if we have the participant, in this case, we provide a service, we would like to have the social worker to at least the person. But remember, not everyone. Remember, we saw some of the center, they have the program aid, provide the risk screen, but it's not their scope of practice. Need to be social worker or need to be RN. Okay, so when they find out this one, they the progress now need to have this kind of documentation, then refer to someone who is in charge of one. Could be social worker, or if we all participants have these issues, we can contact one of, like we say, the depressions, geriatric depression scale, the assessment, and then we can have obtain the score, and then we do a referral. In this case, if for the participant, or if for the participant distress is go to the depressive mood or depressions, then we need to refer to LCSW. It's just coordination between, after we find out the needs, the coordination between the social worker and the coordination with our LCSW. Then remember, after the documentation, you need to follow up. What's the score? What's the next time when you talk to the participant? And then you need to describe how's the outcome. Okay, yeah. So that's pretty much how we do follow all the documentations.